Your initial book, Vasectomy, The Cruelest Cut of All, was first released in 2006. So why the need for a second edition?
The trigger was that the publisher went out of business. However, beyond that, the book has helped a lot of men. I've had more feedback from this book than probably any other one I've done. And the feedback has been from men who've had a vasectomy and they really appreciate the content and one's considering it. So I felt it's important to have it out there. The other component is I'm a curious person by nature. I'm always wondering about things. And I was curious, has the research shed any new light on the matter since I did the research back in 2003, 4, and 5. And that was another huge motivation for it.
In doing your research for this second edition, what changes have you discovered since the initial publication?
Not sure that it would qualify as an actual change, more confirmation. In the first edition, I really presented and highlighted how the pain syndrome is related to fibrosis and nerve entrapment. And the research since then has really strengthened that perspective, certainly based on the popularity of so-called denervation procedures where nerves are removed, and that seems to yield a very good outcome in post-vasectomy pain syndrome. So it's a real confirmation of that. There's no change in the identified mechanisms. Nothing new has come out, but it's really a confirmation of that role that I stressed in the first book.
So why does vasectomy still persist?
In detective shows, a common theme is follow the money. And that applies here with vasectomy. Vasectomy is a very fast procedure for skilled providers to provide, and it brings in a lot of money. The amount of money is actually quite staggering when you look at it. So that alone means it's not going to change easily. The other issue is that it is effective in preventing pregnancy. It's very effective. The problem gets into, though, of what happens to people who've had a vasectomy, and the pain syndrome is still not appreciated enough and not communicated so well to those considering vasectomy.
If someone has post-vasectomy pain syndrome, what do you recommend?
Based on the research for the book, the initial one and the new edition, I think it's really critical to get at the nerve entrapment, which probably is a common pathway to almost all instances of post-vasectomy pain syndrome. That's really critical. In addition, I think to have a vasectomy reversal is important because it will help to prevent a recurrence of sperm granulomas, which are often a source of nerve entrapment or can lead to fibrosis that then entraps nerves.
What would you suggest to someone considering a vasectomy today?
That's simple. Don't get it. I use the word simple there because one of the key aspects of the rhetoric behind vasectomy is a safe and simple procedure. It is not simple at all, and it is not safe. Once that cut is made, a whole series of changes occur to the male reproductive system related to back pressure in the system. That creates ongoing problems, and post-vasectomy pain syndrome is really the proverbial tip of the iceberg. That 5% with severe pain, 15% with some degree of pain, is just the tip of the iceberg, reflecting the damage that is occurring to the reproductive system that forms the body of the iceberg below the water.
When it comes to developing post-vasectomy pain syndrome, is there a stratification of patients that currently exists that allows them to potentially be identified as a higher risk patient?
That's an interesting question. Based upon what I encountered, there's not a lot of, or any really criteria to go by. If a person, or male, has pain in the testicle area, then that would be an indication that there could be more problems, certainly. But other than that, I don't think there's there's no way to decide, okay, this person will be okay, that person won't. It seems to be almost a random occurrence, and it might be even just as random as what nerves get entrapped in fibrosis for a given male at a given time. It could be that random.
What role do the partners play in the discussion around vasectomy?
Well, the partner plays a role, and a very key role, and that hopefully would be to help prevent the person from incurring severe lifelong pain, unless there's very complicated procedures applied. So it's important that the partner be aware of this problem and suggest alternative means. One thing that I put out there in the book is that if a couple has a solid relationship, they can probably figure out alternative methods for birth control beyond having a vasectomy or tubal ligation, in other words, non-surgical. If the relationship is solid, there are other ways to deal with this.
You mentioned in your book problem with the vasectomy surgery in third world countries. Can you elaborate on that?
One thing that really bothers me about the vasectomy procedure is that while the chances are reasonable of a man getting effective treatment in a first world nation, provided that there's the money available to do that, the chances in third world countries are almost nil. I mean, often the money isn't there to do it, the surgical expertise is usually not there, and so then the disadvantaged do what they so commonly do, suffer. And if vasectomy was stopped being applied as a safe and simple way of dealing with pregnancy concerns in third world nations, then a lot fewer men would be suffering from chronic pain.